Hello, good crowd. As we wrap up the show, the final 50 episodes, I am excited to bring back a few of my favorite guests. And Liz Scott is with us today. She's the co-executive director of Alex's Lemonade Stand Foundation, and she's the mother of Alex, the extraordinary young woman who founded this as a child. If you don't remember the story, stick around because you don't want to miss this episode.
Welcome to the Your Mark on the World show with your champion of social good, Devin D. Thorpe.
Our sponsor, Johnson & Johnson, matches most individual donations up to $250 at caringcrowd.org. Liz, welcome back.
Thank you. I am honored to be back.
Well, we're thrilled that you would make time to come back and give us an update on how things are going at Alex's Lemonade Stand Foundation. But before we get into that, I know there are probably a few people who are listening to the show now who missed the last episode and, may not know the whole story, but maybe you could just tell us a little bit about Alex and how she got this foundation started.
I would love to, of course. So Alex was my daughter. She was diagnosed as an infant with neuroblastoma, which is an infant cancer primarily. And she would go on to fight her cancer for 7.5 years and died at the age of 8.5. But the reason we're talking today is because remarkably, when she was 4 years old and had been through a lot of treatment herself, she knew that we could do better for other kids. And she decided she would try to help. And I guess as only a 4-year-old could dream up, she decided she would do a lemonade stand to raise money and donate the money to her hospital. And that's really how it all started.
Well, she really is an inspiration. And she thought she could maybe inspire people to raise $1 million before she died, and really pushed for that and was successful, right?
She was. So she had her first stand. We thought she would raise $5 or $10. She raised $2,000. And I guess we should have known it was the beginning of something pretty special. She had a stand every year for the rest of her life. And every year she'd raise more money. And then she decided in 2004, she was 8, and her cancer was really progressing quickly, that she would try to raise $1 million with the help of other people. And it became this incredible call to action. And people set up lemonade stands and sent their money to her, and she unbelievably reached her goal of $1 million before she died at the age of 8.5.
Wow. Well, $175 million later, you're still going. Tell us about the nature of things in Alex's Lemonade Stand Foundation world today.
In a lot of ways, it's a lot like when Alex started. We really are inspired by her and by all of the kids out there fighting to do better for children with cancer. It's the #1 disease killer of children in our country, and the treatments to cure those who do get cured are really harsh and leave a lot of long-term side effects. So, in that way, we're very much dedicated to curing all children with cancer. But in other ways, the foundation unbelievably has grown from our front yard to $175 million raised, and thousands and thousands of lemonade stands and other types of fundraisers that people do all over the country, all in an effort to help us change the lives of children with cancer and their families.
Well, it's inspiring work that you're doing. You also serve as an editor on the Cancer Today journal, right? Cancer Treatment and Research Journal. Over the years, you've become something of an expert, or at least conversant in the state of play of cancer treatment. Give us a little update on especially how childhood cancer treatments are developing and evolving, largely with your help.
Yeah, it's been really rewarding to see the progress that's being made. Obviously, it's too slow for my taste and for all the parents out there whose kids are fighting. But we are making progress, and we are seeing new cures. And most importantly, we're seeing cures that are less toxic and allow the children to go into remission and to be cured without harsh chemotherapies and radiation therapies. So everything we're investing in is biologic based, so immunotherapies, vaccine therapies, targeting very specific things in a child's body that will stop the cancer from growing and ultimately let them be cured with less side effects. So we're not there yet in terms of it being frontline, but what we're seeing is a lot of the investments we've made have allowed children who were basically incurable, meaning everything, all of the known cures and chemotherapies and everything had not worked for them. And those are the first kids that we're always able to try new treatments on. And some of those kids are achieving remission with these new types of therapies, which is really promising for the future. Cancer in general, I think everybody's really excited about the direction it's moving and the hope that we can ultimately reach the day when most, if not all, cancers are curable.
It is exciting to be talking seriously about that because a generation ago, although we talked about curing cancer, it was in the same way people talked about going to the moon in the 19th century. It was very ethereal, and I don't think we knew collectively, and I don't want to put myself in the group of scientists, but I think people just didn't know how hard it would be. And so it was very aspirational, but not very realistic. Now, we know so much more. Don't you think that these conversations are serious and realistic, and cancer is becoming more treatable, right?
Absolutely. I mean, look at, where we were, say, my parents' generation. If a child was diagnosed with leukemia, not a very high chance of surviving. Now we're talking 90% curable for the most common type of ALL. And then even relapsed ALL, they're able to put about 90% of those kids back into remission using the new therapies, the T-cell therapy, immunotherapy. So there's a lot of promise, not just in leukemias, but in solid tumors for kids. It's a super exciting time. And we know there's still a lot of work to be done, but we feel really hopeful because we've seen some of the successes and we know what's possible.
Alex received some of the earliest implementations of immunotherapies and some of those things. And it's interesting, I have a cousin who was in fact going through treatment when you and I spoke last, and he received rather routinely some of the very same treatments. And he has survived and thrived. He's 2 years cancer-free. That's the reality that you're seeing more and more often now, isn't it?
Yes, it is. I mean, that's a great point. So thanks to research, even kids like Alex, I mean, she's a great example, who were incurable are able to, at a minimum, live longer lives. And for a child in a family, that's really important. Alex was basically declared incurable when she was 3, and she lived to be 8.5. 3 of those years on experimental treatments were the best years that she had, where she felt pretty good. We were able to do so many things as a family. She was able to start her lemonade stand. So there's very much the idea now that we can extend lives and we can do it in a way that there's good quality of life. And then ultimately with the goal that there will be time in that space to find a cure for every child.
What is the timeline you see for moving forward to make successful treatments easier, to make more cancers treatable, to improve outcomes for everybody? What's the timeline?
That's a hard question. I wish I knew. I would say, on the one hand, it's way too slow. There's a lot involved in taking a discovery in the lab all the way through to a safe clinical trial in a treatment for a child or even an adult, but especially for a child. But having said that, we're seeing now that timeline can be shrunk with investment. So we are, as an organization, we invest in not only the early science, but we'll give a grant to a researcher who's made an innovative discovery. We'll give them a 2-year grant to quickly expedite that. And at the end of that 2 years, they're expected to have a clinical trial. And then we're giving out biological therapy grants, biotherapeutic grants, and those are saying, you know what, you may be 5 years off from being ready for a multi-institution or even commercialization of this treatment, but we're going to give you money to do pilot a study with children in your institution. So we're really trying to crunch down that time frame. We've seen things go from discovery to clinical trial in a couple of years, but typically that's when something already exists. So they make a discovery and they realize there's already a drug that might work in that particular type of cancer or the way that mechanism is. But really, our goal is to shrink that timeline and to see where we can fit in and fill those gaps to make it as quickly as possible. But unfortunately, I'm not giving you a straight answer. I don't have the answer, but I think certainly fast forward 10 years. And I do believe that many of the childhood cancer diagnoses that are much more challenging now will be less challenging then.
One of the challenges that face children's cancer and treatment and progress in this field is that not enough children, this is a horrible way to put it, it's the wrong way to put it, but they're essentially orphan diseases, right? That there aren't lots of kids that get each one, but instead there are lots of different cancers, each requiring a different treatment in order to save all the kids. And so it's not economically viable for a lot of the cancers that kids experience. And I don't know if neuroblastoma is one of those, but certainly that is a problem, it seems. Tell us a little bit about how your institution makes a big difference because of that.
So we are a not-for-profit. So, there's charities like ours and a whole lot of other charities across the country who our goal is not to make profit. Our goal is not to find a treatment that's going to, be a blockbuster. So we have the ability to attack the problem with as much money as we can raise, and again, try to fill those gaps. So we need innovative discovery. So we're going to invest in that. We've invested for years now in young investigators. We need new minds coming into the field to study pediatric cancer. So we invest heavily in that. And then we have this whole space between discovery and clinical trial that we invest in. And then at the other end of it, we invest in the trials and we invest in institutions to give them the infrastructure to run these trials. So if you can imagine, a drug company developing a drug would pay, pretty massive amounts of money for the infrastructure to get that drug through all the necessary trials so they can bring it to market. That's not happening in the rare space, meaning most childhood cancers. So we are providing the infrastructure that's not being provided. We're giving the hospitals funds to run clinical trials and to expedite this. And to ultimately, obviously, the goal is to have an option for all children to be cured.
You've been at this a while now. It's been, am I thinking about this right? 15 years since Alex passed away.
Yes.
As you reflect on that, Liz, what are you most proud of having accomplished?
I mean, it's the kids who've been cured already from some of the things that we funded, and there's a lot of them. Kids who literally were in the same position that Alex was in when she started her lemonade stand. Their parents were in the same position we were in, where we wanted something because nothing had worked, and they were able to get into a clinical trial to get access to a new treatment, and that treatment worked for their child. And we're talking about kids who are now 1, 2, 3, 4, 5 years in remission, thanks to research that was funded by Alex's lemonade stand. That to me is why we're here. And personally, as a mom, I feel like that's a gift to me in a way. Alex lives on in all those kids, and I feel really proud of that.
What's the most important lesson you've learned about this work that you would share with others who are doing similar parallel work?
I think the most important lesson is it is a solvable problem. It seems like a big problem. It seems like it might be unsolvable, but with enough resources and talent behind it, I know we can change things because we've seen it happening. We just need to scale that up. So I guess the lesson is don't give up, really be optimistic and keep pushing forward, and together we will accomplish really amazing things for the kids.
As you think about your experience as a mother, as a parent, there are a lot of parents who kind of walked where you walked. And it's horrible, horrible. But most have not gone on to do what you've done. What really do you think was the difference that inspired you to stick with this work, as painful as it may be at times? Why have you done it?
I think at first I really felt I was doing it for Alex, and it was a way to keep taking care of her, and to fill that need to feel closer to her and to continue having her in my life in some way. Now, as time has gone on 15 years, it's really because of two things: the progress we're seeing, and we're seeing that if we keep doing this and we keep making good investments, we can change things for other families. And it's the families we meet along the way. There's so many wonderful kids, just like Alex, just as sharp and funny and sweet, and their parents and their siblings who want nothing more for them to be than for them to be cured and to get to grow up. And stopping now, I feel like would be giving up on those kids, and that's not something I could do. They're too important.
Liz, what is your superpower?
I would say, if this counts as a superpower, probably gratitude. I think you have to get through something really hard in life, as we went through with Alex and losing Alex. You have to be able to feel grateful. You have to be able to feel grateful for what you have currently, and to feel grateful for what you had. And with any loss, that's really important to feel as though the loss of the person doesn't take away from the greatness while they were here, right? And it's the greatness you want to remember and be thankful for. And it's the loss you want to try to fill up with positive things and gratitude for what you do have in your life.
Now, that is an inspiring message, and I appreciate you sharing that. You are inspiring. Alex is inspiring. Her legacy inspires us. We're grateful that you take the time to share all that with us today. Before you go, would you take just a minute and tell people how they can learn more about Alex's Lemonade Stand Foundation and how they can connect with you or make a donation?
Yes, of course. And first of all, thank you so much for having me on again. It's really an honor to be on your list of people to talk to near the end of this programming. But you can learn about Alex's Lemonade Stand at our website, of course, alexslemonade.org. But the easiest way is just to Google Alex's Lemonade Stand, and we will certainly come up high on that list. We're on all the social media channels. There's always a lot of great content and different ways you can learn about childhood cancer, and you can learn about how you can get involved and make a difference.
Fantastic. Well, Liz, thank you again for being with us today, and we wish you every success in your efforts to cure childhood cancers.
Thank you so much. I really appreciate it.
All righty. Let's do some good.
At Caring Crowd, we believe everyone has the power to make a difference. Through our crowdfunding platform for community health, we empower passionate people to drive real change. Whether you work for a nonprofit organization, volunteer, or want to get involved for the first time, you can post a campaign on Caring Crowd. Join us, because caring is where change begins.
Thanks for tuning in to the Your Mark on the World show, the Social Impact Podcast. Please subscribe via YouTube, iTunes, Google Play, Stitcher, or Spotify.